South Africa is ranked among the countries with the lowest score on mental health. In order to address this, the Health Department will today be hosting from today be hosting a two-day mental health conference. Some of the topics will include the youth's mental health, as well as the role of the media in shaping the narrative around this issue. For more on this, let's bring in Jeanette Hunter from the Department of Health, who joins us via our video link this morning. Jeanette, thanks very much indeed for your time. What an incredibly timeless issue, the issue of mental health, the well-being of the country at a moment like this, taking into consideration all of the challenges we're facing. And of course, at the top of that list, or among the top of that list, will obviously be load shedding. What's the department hoping to achieve by opening up this conversation?
So, Michelle, we recently took stock of the success of our implementation over the past 10 years. And that assessment showed that there were some successes but many failures. And that culminated into us updating our policy and strategy. And what we are trying to achieve with this two-day conference is to get input from South Africans to guide our implementation strategies to do better in the next 10 years. So the participants and attendees are scientists, budding researchers, representatives of civil society organizations, as well as people with lived experiences. So, and there's 3 plenaries with more than 80 satellite breakaway sessions. And so I think the conference report will be quite a rich report that will definitely be able to guide us with our future implementation.
So, Jeanette, when you talk about the fact that there have been some successes, what would that be?
Okay, so we've improved the governance in the provinces. We've appointed, you will remember that with the Life Isirimeni incident, which was a very unfortunate incident that should not have happened the way it has happened. The Umbat had found that Gauteng's review board was actually, the word he used was moribund, which is a very strong word. So we've reappointed in all the 9 provinces, and this is now almost 6 years ago, the different committees in the provinces, and also trained them in terms of their role. We also have regular meetings with them as the national department to make sure that the mental health review boards are on track. Another one is also in 2018, we introduced a grant specifically to increase human resources for mental health. And this is human resources at the coalface. And so we're doing well with all resources except psychiatrists. We do have enough psychiatrists in the country, but they are not working in the public sector. So increasing the numbers is a success. But where they are working is not that much of a success, because you want skilled professionals in every corner of the country, not just in the urban centers. And we've also, I don't know, there was recently a clip about an incident at Helen Joseph Hospital of someone complaining that their relative was in casualty for many days. Now, that's not because there are too few beds, but it's because we are frankly inundated with individuals with psychosis due to the incidence of drug abuse in the country. So we've also had some successes in terms of adding extra units and thus extra beds in about 40 hospitals in the country, but that is too slow. So where there's a win, there's also a loss, in terms of what we are able to do, within the limitations of budget constraint. So the strong ones is definitely some infrastructure improvements and an increase in human resources. But there's still 40 hospitals are too few. We've got about 300 hospitals in the country, so you can see we're definitely going too slow.
Yeah, absolutely. And while you're speaking, Jeanette, in the bottom right-hand side of your screen there, for the sake of our viewers, President Cyril Ramaphosa arriving in Benoni this morning. That's where the President will be laying a wreath at the grave of Oliver Tambo. You'll see he's flanked there by the Gauteng Premier, Banyaza Lesufi doing the usual greetings as he then will surely make his way to that wreath-laying ceremony. And of course, it's on the day 30 years ago that Oliver Tambo passed away. We're going to be tracking that story, also give you a sense of what the President has to say when he does give an address at that ceremony as well. Plenty of questions there insofar as the ANC of Oliver Tambo and the ANC of 2023. So we'll stay on that live picture and wrap up our conversation with you, Jeanette, this morning with this focus, this incredibly important focus on mental health in our country. You talked about the fact that limitations on the budget does have a big role to play in terms of what the department can do. That limitation on the budget is, of course, exacerbated by issues around corruption that has dogged many parts of the Department of Health, perhaps more specifically here in Gauteng.
Absolutely. And on top of that corruption is also just inefficiencies in the departments, even if it's not due to corruption or theft, but just using the money that we have better. And that's the conversation that we are having with the Treasury, and they're saying you need to show stronger controls together with the Auditor General of South Africa. You need to show stronger controls that you are really protecting, your system, your department against corruption, but that you also have skilled people to not bring about inefficiencies, because there are competing priorities between health and other sectors like education. And then within health, there's competing priorities. So we got to do the best with our rand. And even as an official within the department, we're really hoping that government will bring this corruption, to an end.
Yeah, couldn't agree with you more, Jeanette. Just as we round off our conversation, you said there'd be a number of stakeholders as part of this two-day seminar, on mental health. Can you give us sort of a guide of the big ones that will form part of these discussions?
So let me also, I almost omitted, we are doing the conversation, this conference in partnership with an NGO called the Foundation for Professional Development, and they've really been the secretariat to the scientific committee because it's an independently put together program. We did not have much input into the program other than that people would want to hear what the Minister of Health is saying, about mental health, and then tomorrow we've got the Deputy President. So we've also got Christine Ngumalo on the program. You will remember that she is a relative of one of the Isidimeni victims. We've got the universities from around the country, and then we've got individual speakers who are individuals not connected to universities or organizations, but simply because they have a story to share by virtue of the fact that they are living with mental illness, managing their mental health.
Such an incredibly important story. This mental health conference getting underway this morning over the course of 2 days. Can't overstate how important this is. Hopefully some tangible things do come out of it. Jeanette Hunter is the DDG for primary health care with the Department of Health. Jeanette, thanks very much indeed for joining us.